Cholera is a deadly disease that has been around for many centuries. In Zambia, the first cholera outbreak was reported in 1977, and we have since then experienced various outbreaks. But it is clear that this year was the worst in Zambian history. The epidemic started in October 2023, and as of April 8, 2024, the Ministry of Health had reported over 22,000 cases and a total of 729 deaths.
It picked off quite slowly, but numbers continued around October up to November. And then suddenly we had a huge rise in numbers around January, where, for example, we were forced to open a national cholera treatment center called Heroes Stadium. We had to convert it into a hospital because we had so many numbers in the facilities. We were reaching, as Lusaka province, over 500 cases in a day.
Cholera spreads rapidly through contaminated water and food. And this is often exacerbated in areas where there's unsafe water, inadequate sanitation, and limited access to quality health care. The impact of cholera is especially severe on vulnerable populations, particularly children and young children.
In the face of this relentless crisis, UNICEF and its partners swiftly mobilized to deliver life-saving interventions and support to affected communities. The response focused on 3 areas: prevention, treatment, and long-term capacity building to strengthen the existing health systems.
So what they say, prevention is better than cure. Why? If you prevent something, then it's much better than curing it.
UNICEF worked tirelessly to promote hygiene practices. By partnering with the Government of the Republic of Zambia, local communities, and other stakeholders, we were able to educate and empower individuals in communities about the importance of good hygiene practices, such as hand washing and safe food preparation.
We have seen an improvement in how people are washing their hands, how they are caring for their environment, and disposal of waste.
UNICEF supplemented quite a substantial amount of medical supplies, including ORS, including water testing kits. They have supported us around transport as well, which has been very, very useful. And also supporting volunteers, knocking door to door, spreading the message against cholera. During this period, we also implemented oral cholera vaccine, and it was a very successful vaccination campaign. We had close to 99% coverage of the targeted people. And now we are looking at sustaining the main efforts, particularly at community level.
Anything for communities cannot be done without communities. Communities play a central role in promoting good hygiene practices and adapting interventions to meet their specific needs and circumstances. Communities are the drivers of change.
We have got people coming to appreciate us at the facility where they are saying what you did was a very good thing. We are able to learn from you. We are able to come at the facility and ask questions because you came to us first before we even came. If you are able to speak to 1 or 2, you have made a difference.
The Child Protection Section has been supporting the Ministry of Community Development to identify families at risk of contracting cholera or those who were affected. And there's CWAC, which is Community Welfare Assistance Committee members, go through visiting households and identifying those vulnerable households.
Chintu chamene napunzira kuti muntu olwadwa cholera ankala sichumwa ankala muntu. So if family tiri community ndife tifuna kuwatandiza because tikavalekelera avanishi taluza abantu. Whatever I have, I can help her. Now, because I don't have resources, I just do it what I can manage. And I do it freely. We wash the patient, we wash the clothes, we clean the house, we do all those things.
Just the fact that they are so optimistic that, no, I'm trying to get my community out of here. I don't want any more deaths in here. And for me, that is what gets me up every morning, that I have to do my part so that we get to a point where we see cholera-free Zambia and do even more for our communities. So the sensitization continues.
Zona discrimination yenze maningi. Vantu wenzo chitaba kamvera nangu ati apa panyumba pali muntu adu okay monga mwamene nali time ya cholera. Apa panyumba pali mwana nangu diarrhea. Abo iyo nyumba iyo family swanga valete pafupi. Vazi bati ni cholera hii bazati ambukiza. Bezo zwabati kulibesha mene vangati uze ni badoti panyumba papezika cholera, so kulibe advise yani vangati pasi. But later on cholera inabwa yapezeka ati yenze kungena pali ponsi. So bantu anabwera bavomera palasi kuti cholera ibwera mosiyana. Sometimes ni moyenda mwamene vaenda bantu penango ni mosobera mwane basobera bana bazaenda bakomane na hevi. So pangono mkukamba na beve bantu banamvera and discrimination ija inabwera yachitamunga yasira.
We could arguably say that we have made very substantial progress. I think this progress has come about because different stakeholders sprang up into action and began to work together.
We've learned that collaboration and partnerships are indispensable. Addressing cholera requires multi-sectoral efforts involving communities, governments, healthcare providers, non-governmental organizations, individuals. By pooling our resources and expertise together, we can develop comprehensive strategies to prevent and respond to cholera outbreaks effectively and efficiently.
We should continue for future purposes. If any should arise, any of the disease or cholera should arise, we are well able to manage it, we are able to sustain, and we are able to help out and to reach out to others.
We will continue working to ensure every child and community has access to safe water, sanitation, and quality healthcare. Together, we can create a brighter and healthier future for all.
Manta kwene Manta nilibe. Chifukwa chakuti tinapunzisiwa pali manje. Apa peve manje tirina knowledge, tina idea mwamene tinga igonja sele.